In December 2019, the Chinese authorities notified the world that a virus was spreading through their communities. In the following months, it spread to other countries, with cases doubling within days. This virus is the severe acute respiratory syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. What actually happens when
the virus? Coronaviruses are a large family of viruses. Some cause illness in people, and others, such as canine and feline coronaviruses, only infect animals. Rarely, animal coronaviruses that infect animals have emerged to infect people and can spread between people. This is suspected to have occurred for the virus that causes COVID-19. Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS, are two other examples of coronaviruses that originated from animals and then spread to people. More information about the source and spread of COVID-19 is available on the Situation Summary, Source and Spread of the Virus on the cdc.gov website. How does a virus spread? The virus was first detected in Wuhan City, Hubei Province, China. The first infections were linked to a live animal market, but the virus is now spreading from person to person. It's important to note that person-to-person spread can happen on a continuum. Some viruses are highly contagious, like measles, while other viruses are less so. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community spread in some affected geographic areas. Community spread means people have been infected with the virus in an area, including some who are not sure how or where they became infected. Learn what is known about the spread of newly emerged coronaviruses on the cdc.gov website. Can someone who has had COVID-19 spread the illness to others? The virus that causes COVID-19 is spreading from person to person. Someone who is actively sick with COVID-19 can spread the illness to others. That is why CDC recommends that these patients be isolated either in the hospital or at home, depending on how sick they are, until they are better and no longer pose a risk of infecting others. How long someone is actively sick can vary, so the decision on when to release someone from isolation is made on a case-by-case basis in consultation with doctors, infection prevention and control experts, and public health officials, and involves considering specifics of each situation, including disease severity, illness signs and symptoms, and results of laboratory testing for that patient. Current CDC guidance for when it is okay to release someone from isolation is made on a case-by-case basis and includes meeting all of the following requirements. The patient is free from fever without the use of fever-reducing medications. The patient is no longer showing symptoms, including cough. The patient has tested negative on at least 2 consecutive respiratory specimens collected at least 24 hours apart. Someone who has been released from isolation is not considered to pose a risk of infection to others. Can someone who has been quarantined for COVID-19 spread the illness to others? Quarantine means separating a person or group of people who have been exposed to a contagious disease but have not developed illness, symptoms, from others who have not been exposed in order to prevent the possible spread of that disease. Quarantine is usually established for the incubation period of the communicable disease, which is the span of time during which people have developed illness after exposure. For COVID-19, the period of quarantine is 14 days from the last date of exposure, because 14 days is the longest incubation period seen for similar coronaviruses. Someone who has been released from COVID-19 quarantine is not considered a risk for spreading the virus to others because they have not developed illness during the incubation period. Can the virus that causes COVID-19 be spread through food, including refrigerated or frozen food? Coronaviruses are generally thought to be spread from person to person through respiratory droplets.